Okay, good evening and good morning to each and every one of you. It's my happy privilege to welcome you once again to fourth in series of our ACC training for emotional care and support that we had begun about 3 weeks ago. And if you'll remember, our first session was on communication skills, just the basics of talking with people who needed social and emotional support. How do we begin talking with them? And the second session we had was on psychological first aid. That was to know and understand the psychological needs. What were some early signs and symptoms that tell us a person is in distress or experiencing anxiety, and how do we need to reach them? And then the third one was on principles of grief counseling, which was about knowing and understanding the people who have lost their loved ones and are grieving. How do we appropriately approach them and say words that are appropriate for that situation and for that person at that particular time? And I hope these sessions would have been useful for you. I don't want to ask at this point if you have been practicing any one of these principles, but we will have a session that we would like to know from your end. Tell us, share with us stories of your experiences. If you were engaged in sessions with anyone, what has been your experiences? Okay, so we'll have it for another time. But today we are very excited and happy to have a very a panel of experts amidst us, and they are all my colleagues, and I'm so happy to welcome them on the board today. But before we welcome them and introduce them to the group today, I would like to invite Mr. David Chan, my husband, who is an assistant professor in the Department of Teacher Education in the School of Humanities, Education and Humanities here at the University of the Southern Caribbean, to offer a prayer before we begin. Yes.
Let's bow our heads and close our eyes. We're going to pray. Our Lord and our Heavenly Father, it's a wonderful privilege of ours to be alive and to give praises and thanks to Thee for the way Thou have been blessing us, blessing the presenters and the recipients as well of those presentations. Lord, we look forward to another wonderful day of learning. And we ask Thee, your blessings be upon those resource personnel who have prepared themselves, are going to present the wonderful knowledge that they have been blessed with, and those who are desirous of learning these skills and implementing to relieve pain and suffering from the human family. This we pray in Christ Jesus' name. Amen.
Amen. Thank you very much.
Amen.
We are ready to begin. So once again, it is my privilege to welcome each and every one of you, and thank you for attending this session week after week with us. And those who are joining us for the first time, welcome. And I hope you'll find these sessions useful. These will be also available via YouTube. A link will be provided to you all shortly, so that you can take advantage and be able to, get information while you are deciding to engage in giving social, emotional, and spiritual support to people in need. Okay. So at this time, I would like to invite our panel for this morning, and let me just introduce briefly, one by one, to them, to you. So first we have Dr. Glenda Hinkson. We had met with her last time, and we are very glad to have Dr. Hinkson amidst us. And we want to welcome you to our presentation this morning. So the theme of the presentation today is Principles of General Counseling. So they will be looking at the different dimensions of counseling from different angles. So Dr. Glenda Hinkson will share with us the definition and techniques of counseling. That is very, very important, very basic too. So we welcome her. And then next we have Dr. Edward Clarke. He's also joining us. Again, you would have heard from him when he presented on the psychological first aid. And of course, you would have heard Dr. Hinkson when she presented on the principles of grief counseling. She is the chair for social work at in the School of Social Sciences, and she is specializes in family therapy and grief and death counseling. And Dr. Clarke is the Dean of the School of Social Sciences here at the University of Southern Caribbean, and he's a social psychologist, as well as he specializes in emotional intelligence. So welcome, Dr. Clarke. So we have a new person that my privilege to introduce to you today. She is my colleague. We worked together when she was at the University of Southern Caribbean. Dr. Camille Huggins. She is specializes in social work, and she's a social worker, and she's currently a professor at the University of West Indies here in Trinidad and Tobago. So welcome, Dr. Camille Huggins. What a privilege to have you share your expertise and knowledge with each and every one of us. So I'm not seeing Dr. Niles at this moment, but he will join us shortly. So we are ready to begin. And Dr. Hinkson is presenting on the definition and techniques of counseling. Followed by Dr. Clarke, who will be presenting on the goals of counseling. And he will be followed by Dr. Camille Huggins, who will be discussing with us counseling processes. And to bring it to the close, Dr. Niles will present on approaches to counseling. So we will go ahead and begin our session for this morning. So over to Dr. Hinkson.
Good morning and good afternoon, everyone. I will be sharing a short introduction on what counseling is, its purpose, and some techniques used. So counseling at its lowest denominator is a relationship between two persons in which one of them assists the other. Counseling can also be defined as giving professional help and advice to someone to resolve personal or psychological challenges. According to the American Counseling Association, counseling is defined as a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and even career goals. So counseling can assist with understanding yourself, your loved ones, and your relationships with them. It can assist with speaking your fears and perceptions of the world and others. And it can assist with feeling safe about expressing any emotional troubles or private concerns. Counseling allows you to develop a relationship with someone who is safe, confidential, and can provide a listening ear, especially if there are others who cannot do that for you. So counseling requires skills and techniques personally for the counselor and also towards the client. The purpose of counseling is to first identify the person's challenges or issues, or even if you phrase it as their problem, and to identify, increase, and to develop problem-solving skills and their personal and family strengths. These will all help to improve the client's functioning. This can be as simple as improving one's understanding of your own thoughts, feelings, and responses. It is important to know that counselors do not fix the problem. They assist in understanding, they assist the client in understanding what is happening in their world and how best to manage them. So there is an allowance to describe and share their feelings, their thoughts about their life and their challenges, to reach decisions and return to a level of normalcy or functioning. So some simple techniques that we sometimes may use in relation to others, but specifically that counselors use, are you must build a rapport with the client. You must connect with them, let them know that you care. You must establish trust in the relationship. Also, listening skills. Listening skills are needed to show that the counselor, you, understand and interpret the information that the client is giving you is correct. It is an art of obtaining the information while encouraging the client to open up and to share their issues. So you, the counselor, have to be attentive, responsive, and be an active listener. Paraphrasing is another technique used, and this is repeating what the client has said in a brief statement or using other words and ask if you understand what the client has said correctly. This will ensure clarity between you and the client. So in terms of clarification, you seek to ensure that you have understood what the client has said. This ensures that there are no misconceptions and hopefully that you are not making any assumptions either about the client, their feelings, or what they have shared with you. Also, you ask open-ended questions. You always remain curious. Do not assume that you know what the client means, even if the client is familiar to you. You have to encourage people in counseling sessions to give more details. Thus, you ask questions that allow the client to freely express themselves. So limit any yes or no questions so that the client can go in depth about their statements and their feelings and their thoughts. They may have to give you a story in order for you to fully understand why they think and feel the way they do. And finally, you use scaling questions, or you can use scaling questions. So the counselor can ask checking in questions. For example, on a scale of 1 to 10, with 10 being the highest, how are you coping today? Or on a scale of 1 to 10, with 10 being the highest, how many times a day do you think about your loved one since their death? This allows the counselor to see if the number is lowered throughout the sessions, but it also will allow the client to calmly think about themselves and their functioning. Thank you. Dr. Clarke?
Good morning, everyone, or good evening if you're in India. I would like to thank Dr. Niles, Dr. Hinkson for that brilliant introductory presentation. As I was listening to her and I reviewed my PowerPoints, I realized that I really have very little to say. So I am going to say a few things, invite some questions and provoke some thinking so that we don't have too much repetition. Although repetition is good because it reinforces points sometimes. But Dr. Hinkson did excellently on talking about the elements, the techniques, the purpose of counseling. And I just want to rehash one other point, and then I'm going to go to goals. So let me share my screen with you. Let's do that. Can you see my screen? You can't. Oh, you can.
Yes, we can see it.
Okay, jolly good, jolly good, jolly good. All right. So I am going to just go to the slide here. All right. And it says, let me make it more. Right. Okay. So basically, counseling, I am thinking about you as a Bible worker, you as a person who is concerned about others and you want to help. That's the first important point. You want to help. And you want to provide help to someone that you see experiencing some emotional difficulty. So that's the first thing that counseling does. You have to have a desire to help. And when you have a desire to help, you're going to step forward. And sometimes as you step forward, you might think that you have limited knowledge, you have limited resources. You might even think, well, I don't even know what to say. I don't even know what to say to this person because it's a new experience for you. And you know, you're a bit apprehensive about it. So when you step forward, you need to realize that you are in, or you should be in a better position than the person who is currently experiencing some emotional discomfort. And you are there to give help and support. Now that word support is very important. You're there to give help and support. So whatever you do is to lift the person up, lift them up from the state that they're in. Okay, and you can do that. You can do that. So don't be overwhelmed by the occasion. Don't be overwhelmed by the interaction. Just think that I am here to give help and support and guidance. Now, we need to be careful about this word guidance. I don't want you to interpret guidance as advice, because it is very difficult, if not advisable. It's not advisable to give advice, because your advice might create challenges for the person who's experiencing the discomfort, when your advice might backfire and the person might follow that advice, and it creates a ripple of issues for them that you probably wouldn't have known, because you might not have known all of this external circumstances. So it is best for you to talk to them and find out what options do they have? What options do they have? And again, get them to assess the options. Now, remember, I'm skipping out a lot of what Dr. Hinkson spoke about so that we can move forward. So you would scope, find out what options they have, and then you get them with you, because the critical thing in counseling, as was noted earlier, is the relationship. The relationship. So you need to establish a relationship between the client and yourself who is in this role of counseling. You might not see yourself as a counselor, but that's okay. But you're in that role when you come to offer help, support, and guidance. You're in that role, whether you see yourself in that role or not. So you need to find out what options the client has and get them to question or analyze the options they have, and then let them come to a decision about which is the best of all the options that they face, that they have, and then get them to think about possibly considering that as the best option. So you're giving them guidance. That's my third point. You're helping them to guide through the maze of options and issues and indecision. You're helping them to do that. You're sort of giving them guidance, sort of showing, the road map, so to speak. Okay. And this is what then constitutes the type of assistance that you will be able to offer. But please don't get yourself in a situation where you're giving advice, because that's always very, very challenging. Okay, good. All right, so let's move on. Okay, it's just okay. I hope so let's go to the next slide. All right, so we said that, and I mentioned it earlier, that there needs to be a relationship. And this is very important. Don't underestimate it or underestimate its importance, a relationship, because when you have a relationship, you can get the client to consider lots of things that you might be suggesting, and that relationship should be one of mutual respect. Don't think that you're better than the person or vice versa, but there should be mutual respect between you. Okay, so let me just go back a bit. Let's jump one. Okay. Oh dear. Okay. So let's go to this one here. Good. Let's open that up. All right, so now we want to look at the goals. So why are you in this relationship with the client? Well, it is because something is happening with that person and they are seeking to change their behavior. In the case that we're dealing with, most often they are grieving because of the loss of a relative or a friend. And you want them to get to a point where they can manage themselves. They can manage themselves with this new event or incident or this new situation. You want to get them to be able to manage themselves, because that's really the problem for most individuals, not being able to manage themselves in different situations. So more often than not, someone is ill, someone is suffering, someone has died. It's created a traumatic impact on the family. There is a shortage of that person, might be the sole breadwinner. So now that person isn't there. There's no money, and everything is thrown into confusion. And so you need to get them to manage themselves, because you cannot really move forward with them until you bring the stress level down, until you bring them to a level where they can begin to think a bit rationally, because their clouded minds because of this event. So you want to help them to change their emotional state. So you want to create change. You want to alter what's existing. So you facilitate behavioral change. That is what you want to have in the person. And to do that, you need to help them to self-manage. You can't manage them. You must get them to have the techniques that you're going to hear about, how to manage themselves. And managing themselves might involve improving a relationship that is broken. We have heard that sometimes a death or an incident or hospitalization might create anger. It might create sadness. It might create a range of emotions, and it can damage relationships between mother and siblings, husbands and wives, families. It can just damage relationships all kinds of ways. And some persons think that I didn't get enough help from my mother-in-law, or my mother-in-law is too oppressive, or whatever. She wants us to come and stay with her. We don't want to go and stay there. All kinds of things. And the relationships get fractured and broken. So what you want to do, you want to improve the relationships. So again, you're there to help them to think rationally and to give them some guidance about how they can improve the relationship. Because when people become emotionally fraught, or when they become very emotional, then rational thinking tends not to be prominent. Your thinking capacity get overwhelmed by the emotion, and then the emotion is the thing that takes over, and then rational thinking doesn't occur. So you want to help them improve relationship. That's one of the second goals, is to help improve relationships between individuals. Third critical point is developing skills to cope. We all have different skills based on our experiences, based on our education, based on a range of prior knowledge. So because you might not have all the skills or the right set of skills in your toolkit to deal with the situation, then the counseling experience gives or adds to your toolbox the kind of skills that you need for this situation, the situation that you're in. And possibly you might even get some additional skills to cope with some ancillary issues that are taking place. So coping skills, absolutely, absolutely important. And we see that very much today as individuals across a range of life experiences struggle with COVID. And people are still struggling with COVID, while others are coping much better. And that is down to the fact that they have employed coping skills. And interestingly, a coping skill for me might not be the coping skill for you. So that's why it's necessary to have, a range of coping skills that would be more applicable to one person than another. And therefore, I might be able to cope by going out and exercising, but then you are someone who you don't like exercising, and it's something you've ever done. And me encouraging you to do that might actually not be something you want to do. You might start it, and because you don't like it, you fall out of, you drop out of it. While for another person, oh yeah, good, that's great. So you see, it depends on an individual basis, and therefore you need to offer the client a range of things and find out from them what it is that they do, what it is they like doing, what it is that they don't like doing, and try to come to some compromise arrangement about the skill that would be appropriate for them. So you need to, if they have a skill set, you can enhance it. If they don't have the coping skills, then you can supply that. You can help them to do that. And then number 4, another goal of counseling is decision making. Decision making. So very, very, very important. What do I do? What do I do? I'm in a situation. What do? Do I go left? Do I go right? Do I go up? Do I go down? Do I stand still and wait? What do I do? And when your mind is clouded with emotion and grief and pain, it's very difficult to think rationally and to even consider what to do. You're so overwhelmed by that, and you might be guided according to what will ease your pain, which might not necessarily be the best decision. So you need to just kind of like self-manage. So step back, think, try to get your thinking going, because sometimes thinking gets suspended in situations like, so you need to step back. And so the counselor is going to, you as the counselor is going to help the person to start to bring the emotional state down to a managing level, so that they can make informed, listen to that word, an informed decision, a decision that they arrived at after considering what I mentioned before, the options. So you want them to make an informed decision, not an emotional decision, because emotions, as you know, can or feelings, as you know them, they can change from moment to moment, and you don't want to be in that, especially if the decision is an important one. So you want, in the counseling environment interaction, to assist the counselee to make an informed decision. And sometimes that takes time. So you need to be patient. You don't want to rush it. You need to sometimes just bring the level down so they can make that informed decision. Very important. And sometimes, it's good that the decision that you arrive at is one that, is that both yourself and the counselor, or the counselor and the client, feels pretty good about. That there is kind of like mutual agreement about that decision that you're about to make. So major goals, these are the 5 major goals. Facilitating behavioral change, improving relationships, enhancing coping skills, decision-making, and goals 1 decided by both the counselor and the right. Now, of course, I'm just going to say this is my last point about goals of therapy, because you whether you think about it from a professional viewpoint or not, you are in a relationship where you're offering therapy, healing, what we call treatment. You're trying to heal them, bring about some healing. So, and this is to help the person to grow, or as I said earlier, to self, at its most basic level, to self-manage. And sometimes you need to focus on the person and not the problem so much, because you'll find that when you go, you'll find that they have one problem. As you talk to them, you find there are many problems. So you want to get the person to focus on how they can manage themselves, and that would make a tremendous difference. And I am going to stop there rather than go through all of these different therapeutic goals, so that we can have time for questions. And I just want to thank you for being here and for listening, and for our brothers and sisters in India. I hope that you have a restful night. Thank you, everyone.
Thank you, Dr. Clarke, for that very, very clear presentation, giving us systematically the different approaches and goals to counseling. And we will look forward for questions on that matter. But before that, we will go to our next presenter, Dr. Camille Huggins, for her to come and present to us on the topic that been assigned to her, and that is talking to us about the counseling processes. So over to Dr. Huggins.
Good evening, everyone. Thank you, Dr. Chan, Dr. Hinkson, Dr. Clarke, Dr. Niles for inviting me. I hope you can hear me, everyone.
Yes,
Yes.
we can. Mhm.
I'm going to talk to Dr. Clarke, did a fantastic job in explaining to you the therapeutic relationship. One to talk to you about is before you could do all that, is the person ready to change? I think as a person who wants to counsel, yes, you have to want to help them, but you have to basically assess, is the person ready to change? As far as the process is concerned, you kind of have to consistently process that. It's a new concept. People all over the world have walked around with a lot of pain and trauma, and they've never gotten help. They've lived, been born out of trauma, been lived with trauma, died in trauma, and they've never received any help for it. When it comes to the COVID-19 situation, we've lived for a full year, some of us going on 2 years on just living in this pandemic, and we've never received, we probably will come out of it, maybe not get a vaccine. And we've gone through a lot of trauma in our homes or through the process, because of or hardships because of COVID, and we would not receive any help or want any help afterwards because we'd just be like, okay, that's over. Let's just go on with our lives and be okay. But for those who seem to want to get help, but they say they want to get help, but they're not too sure, these are the things that you kind of have to assess as a person who's helping them. Their capability to get help, their motivation to get help, their opportunity to get help, and then how it impacts their behavior to want to be helped. So these are the 4 factors, the theory of behavior change. The capability, are they able to be to change their behavior? Their motivation to do it, their opportunity, is there an opportunity to get that done, and their behavior. Life is busy. We have a lot to do all the time. We keep moving, keep calm and carry on is our mantra in life for most people. So, changing behaviors is a big thing that you have to assess. So when we look at our motivation, we're looking at, is the client ready for change? Are they cognitively capable of changing? Can they hear you? Can they hear what you have to say? Do they want to hear what you have to say? Does it matter? So when you're one of the persons who want to volunteer helping, you have to constantly say, can you do this? Do you want to do this? Are you ready for it? The other thing that you're kind of looking at motivation wise is the willingness to change. Are they introspective? You have a lot of people who are not introspective. They don't look into themselves to say, what did I do wrong? What am I doing wrong? Or are there blamers? Are there people who just want to blame everyone else or blame the weather or blame, the milkman, blame everyone else but themselves? They may not be motivated to change. When they come to you, they want you to fix the child and not the mother. They want you to fix someone outside of them except for themselves. So they may not be motivated to change. Then they may weigh the pros and the cons of changing. People are very smart. They would want to know, is there any cons or pros to changing? Does it benefit me to change who I am and my behavior? And if they feel as though there's no benefits to changing, they may not change. Is there any pressure on the outside? You have, as a therapist, have to constantly look at, is there any pressure? Is there anything going on the outside that's going to make me change or not? If there's nothing on the outside, I may not want to change. So I may not change at all. If a husband is beating a wife, what's going to make him change from beating his wife? Is it going to be the police officer going to make him change beating his wife? Is it someone on the outside going to make him change beating his wife? What's the pros and the cons for him to stop doing what he's going to do? So therefore, you have to kind of basically work with that person to figure out what's going on here. The other thing is the therapist. Is there any room for them? Is there a willingness? Is there time? Is there opportunity to make sure that that's happening? So you will have to look at, do they have room? Do they have, there's an urgency? Do you see there's an urgency to change today or whatever? What's the timing? You know, how long is it going to take them? Is there a rush? Is what's happening? Then also what Dr. Clarke talked about, the client and therapist relationship. That also has to do with, do they like you enough to keep coming back to you to want to do this changing? And so all of these things impact the behavior, the client's willingness to change. Is their language changing? Is their behavior changing? So those are the things that you have to monitor first before you decide, okay, we're going to move forward and do the work. Another thing that you're looking at is your decision making. You know knowledge, you have the formal knowledge, you have things that you have the education to do, but you also have the tacit knowledge. You also know human beings, you know your culture, you know what your culture dictates, you know what your gender dictates. So you have to kind of use your intuition. You have to kind of use your gut sometimes. And how is that going to inform your decisions and how you're going to work with somebody? Sometimes it's not you. Sometimes it's just what it is. It's just what's happening right now in the world. You know, when COVID-19 hit the world, some people wanted to work on, you know, hey, you know, this year I wanted to travel. This year I wanted to work on my, you know, being closer to whatever religion I'm at close. You know, sometimes you have to delay things. You have to work with where they are at. What's the emerging issue at this time? And that can basically determine your clinical decision-making skills. So when you're looking at that, when you're looking at your decision-making skills, you're looking at your cultural understanding about what's happening in your culture at this time, when, you know, to make decisions on how to help approach somebody for counseling. You're also looking at the generational understanding. My generation is different from an older generation, which is different from a younger generation. What is the generation saying that they should do as far as changing their behavior? And as a clinician, you should be able to say, all right, if I understand generationally what they're expecting, then I can understand why the person's going to change or not. I have to understand current events. I have to also look at observations and experience. Another thing that you're looking at when it comes to tacit is your direct perception of the truth. What's the client's perception of the truth? What's your perception of the truth? Most often than not, sometimes they're two different things altogether. And sometimes it's not very accurate. There's always a guess. Someone's always guessing. Someone's always thinking that they know. A lot of assumptions happen. I'm always amazed how people can conjure up what they think is happening that's not happening. So far from the truth, but this is what they think is happening because of, you know, it happened to their mom, so they think that's going to happen to them, and so forth and so on. So you have to constantly get at what is their perception of what's happening. Then you have the formal knowledge. You know, you also have, you know, asking the right questions, looking at active listening skills. So these are the things that you have to kind of think about when it comes to, you know, the therapeutic or the processes. Is the client willing to change? And how's that impacting your clinical decision making? So 9 out of 10 times, it's never your fault if a person doesn't want to change or not. You're just measuring where there are in the decision-making skills about that. Another thing that we're looking at when it comes to decision-making, the processes and clinical, is asking the right questions. Dr. Clarke did a fantastic job in explaining to you about the relationship, but how do you develop asking the right questions? That's going to help you with your decision about if the client is ready to change. So I made a bunch of questions that I usually ask is questions for clarification, questions to get to the truth of the matter. These are some questions you ask, like, why do you say that? How does this relate to our discussion? Can you give me an example? This is called questions for clarification. Can you explain further? You know, giving you language. This is just to give you language as a clinician to basically say, how can I get more information from somebody? You could do it in your own vernacular. You could do it in your own style, but you're always asking questions to get more so that the person can clarify what they're saying. You're not putting any words into their mouths. You're just asking them for them to make, make sense of what they're trying to tell you. Another thing is you want to probe some assumptions. A lot of us have assumptions. So you always want them to like probe it. You always want to find out. So is this always the case? If they say, it rains always on Wednesdays. Are you sure every Wednesday it rains on Wednesdays? So you want to probe their assumptions. You want to probe their truths, because sometimes it's wrong, but you want to make sure that they can see for themselves that what their assumption is wrong. And so you question it. We could assume instead, what else can we assume about, he always walks out at 9:01. Why do you assume that he walks out at 9:01? You're questioning what their assumptions are. Why would you make this assumption? That's all. You're just trying to figure out, what they're saying. Is it fact or fiction? That's all this question is basically asking. Again, in your own style, your own vernacular, but these are the kind of questions you're looking for. Then you're looking for evidence. Why do you think it's true? Again, people love to make blanket statements. I'm good at making a blanket statement. But sometimes it's just not true. And sometimes it's just to feed into what you think is true, but it's not true. So your job is to break down their distortions of the facts. And so you're asking, why do you think it's true? Why do you think it causes to happen? Do you have any evidence for that? Those kind of questions is what you're going to ask it for. Then you have questions about viewpoints and perspectives. Why is it best? What are the strengths and weaknesses of what you're saying? What would be the alternative of what you're saying? These questions are just getting to know their perspective. What's their opinion about what's happening? Once you find out as a person who's helping them, what's their opinion, it could tell you if they're going to change or not. If they're saying things like, God has told me this is what's going to happen, most likely or not, they're saying that a third person, a deity, or someone else is telling them that this is what's the truth. You can't change that. You're not responsible for changing that. That is something that they believe in their hearts, and that's something that you need to know as a clinician to tell you what's going to be a barrier for them to change because they believe that somebody else is responsible for what's happened, their actions. But it helps you get a sense of what's happening. Another thing is you want to probe for consequences. If they continue, let's say a husband is beating his wife, what will be the consequences of doing what they're doing? Why do you feel as though, what are the consequences of this assumption? Have you always felt this way? Do you always feel that you need to do this to get the reaction that you want? So you're basically probing to say, do you think there's a consequence to your behavior? Do you think there's a consequence to what you think is happening here? Those are the kind of questions that you're kind of asking to get a sense of how to help them say, maybe I need to change my behavior. Another thing is, just asking questions about the question. If they ask you a question because they want to know what you think, you're like, well, why do you ask me that question? What do you think about what you're asking me? Would my opinion about what I think about the question help you with your decisions? Those are the type of questions you may ask. So a question about a question seems kind of redundant in a sense, but it's not, because it's basically getting to a sense of, do you need my validation to make sure that you understand what you're thinking at the time? Those are the, you're going to get to the heart of the matter to understand how this person thinks and where they're coming from. Again, reflecting back, basically reflecting what they said. They told you something, you're just going to say, well, why do you think this happened? I heard you say that you broke up with John and the whole school knows. So how are you coping with this? So you're reflecting back on what they're saying, and you're just asking them, how are you dealing with it? Are you resilient? How are you coping with it? What are you doing? I know you've been upset with your father and are getting a divorce at this time. Do you feel sad? Those are the kind of questions you ask. You're just reflecting back what has been told. to figure out what's happening with that particular person. Another kind of question is encouraging. You're always trying to encourage. I think that this is one of the better questions because you're being very strength-based. You're always trying to make sure a client feels that they are in control and that they have strengths. And so you can say, you've been so brave, and you say at times when these are happening and how you handle it. So these are kind of encouraging questions. Again, summarizing questions is basically summarizing what has been told to you and just making sure you understand what they've said to you and that you're clarifying it and making sure you understand what's been said. Again, clarifying questions and validating questions. Dr. Hinkson brought up scaling questions, and scaling questions are basically, imagine a scale of 1 to 10. 10 represents the desired situation, and 0 represents nothing that you desire. How do you feel on a scale of 1 to 10? So those kind of questions are very easy. They can basically say, I feel like a 5 because of such and such and such and such. It gets people to talk when they're not thinking that they should talk. But the questions you ask basically elicits a level of conversation that you'll be surprised people will engage in and talk to you about. But that's what I have today. If anybody has any questions, we'll talk about it after Dr. Niles speaks. So thank you, Dr. Chen.
Thank you so much, Dr. Hinkson. Very well presented with so much of clarity. I wish we can go in slow motion, but no, we had a given time. Slow motion in the sense that we would have paused and taken questions, or if people were involved in counseling, then we would have asked their stories. But I think we will have another session where we will interact with people who went into the field and were assigned to interact with people, and how did they go about it and what were their experiences. So very well, very practical steps Dr. Huggins have outlined, and we thank you for taking us through that. So at this time, we invite Dr. Niles to come forward and have your presentation. Okay, Dr. Niles, can you hear me? Okay, so over to Dr. Niles, who will be speaking to us on the topic. Yes, Dr. Niles, can you hear me? Yes.
Yeah, I'm hearing you. Are you hearing me?
Talking to us on approaches to counseling.
Yes, yes. But okay. Hi, guys. Hi. Good night. Good morning. Good day. You all seeing me and hearing me? I hope so. It has been a good morning for all of us, and I'm very, very full of information. So I do not know if you want more, as Dr. Clarke said, but he seemed to be giving all the information that you thought. But let me see how best I can work out this approaches. I'm going to share. Am I going to have problems here?
Make sure you put your presentation to slideshow, Dr. Niles. Yeah.
I will, but I'm trying to get it to move. So that is, I'm stuck. I hope I don't have any. I was having a lot of challenges yesterday. Oh, there we go. Yeah. Wow. Where did my screen go to?
I said we can see you, so that's one thing.
Yeah, yesterday I was in a mess. Like my system wasn't working at all. I had some presentations. I had to stop and start several times. I hope it doesn't happen today.
Yeah, we are seeing it. So you can change to slideshow. Yeah.
Right.
I will. I am. Okay. So introduction to general counseling. You've heard a lot already from the 3 presenters about the definitions and how, and in what they have been saying, it's a lot about the approaches. Even Dr. Cummins just now talking about how to do the encouraging and the questioning, and then we had some paraphrasing and from Dr. Hinkson, and we had Dr. Clarke mentioned the whole issue of how to work through those 5 stages. All that is part of the general concept of approaching. So so what I'm sharing here is more of a kind of generalizing it and looking at these 4 concepts here, just for you to give you a broad idea. The individual perception and making meaning. Because one of the things is that, as Dr. Cummins is saying, does the person want the counseling, even though they're going through their crisis, even though they're having their problems, do they want it? But what about you? Do you want to do this? And sometimes we are faced with an individual perception of what is before us or what is not before us. And we try to immediately make meaning. What we have to do is to realize that we are not the counselee. We are not the client. They're the client. We are just providing intervention for them. And so therefore we have to be careful of our own perceptions and what meaning we are making from the session. The cultural community factors, these are important too for how we approach the person from a cultural perspective. Which town they came from? Are they East? Are they Tamil? Are they from the South? Are they from the North? Are they half Indian? Are they poor caste? Whether they're Madras or whether they're Sudras or Brahmin. How do I therefore approach? Because you've grown up, especially that culture, with the concept of respect and who is poor and who is rich. And what the community says, is this somebody you need to talk to? Is this somebody who you ought not to talk to? So in terms of how we go forward, sometimes you get information, especially from your own ethnic group, and you'll have all these cultural and community factors watching you and says, no, we don't talk to you people. It's like Jesus Christ, and the woman by the well. We don't talk to Samaritans. I mean, they have cousins. They're cousins, but we don't talk to Samaritans. Why? Because of something happened. So that we have to overcome these cultural and community factors that are constantly plaguing us. And I dare say it's not just about being in India. We have it all around. For us in the Caribbean, we may not want to do a Rastafarian, or we don't want to do a white person, or we don't want to do this person who live in that area, or we don't want our clientele to come from. So we always have these perspectives that we need to address. These people have suffered. There is no context of race, ethnicity, culture when COVID-19 hits you. It's COVID-19. COVID-19 doesn't ask permission of any culture or community. So we have to remember that we go through there. Behavioral, physical, neurological approach. How do we behave our own selves? Where are we? And who are we? Are you ready, as Dr. Huggins was saying, are you ready for this? Are you physically okay? Are you strong enough? Are you breathing well? Did you have a good breakfast? Did you have a good night's rest? Neurologically, are you mentally able to handle this? Is it something that you can process? Are you willing to take on somebody else's problems? You have yours. Can you take on somebody else's problems? And those are important. And so therefore, in my sitting down in front of you, and I start hearing your mess, I start swallowing my saliva. We have to be careful about that in terms of our approach. So that would all affect our approach. Your societal professional perspective. I am this particular person. So you see yourself as I am. I am a provider, even though I may be from the pastoral team or I'm the counseling team. We have this societal problem that we think that we are in a particular position, that we can do something so well We need it. Hold on, hold on. We all hit to the ground. You are just here providing. And from a professional perspective, we have to be careful how professional is professional, because sometimes in our professionalism, we lose that factor that Dr. Clarke mentioned about the relationship. One of the key things that we teach is engaging and relationship. So if you try to be too professional, sometimes you lose that because you want to have to dot the I's and cross the T's. Where we're dealing with people and personalities, we have to learn how to shift the T's to an I, or chop the T, or take off the dot and make it an L. We have to be very flexible in terms of how we approach. And these are the four basic factors that help us in our own thinking as for the way forward. There are two basic types of approaches I want to share with you today, the directive and non-directive. The directive approach, where the counselor is able to guide the client's behavior, providing the course of action. The non-directive, this involves the counselors listening, supporting, advising the client without directing the course of action. The counselor allows the client to take the lead and may reflect the information that he or she provides. The counselor also offers possible interpretation or seeks clarification, but it is the client who initiates the content of the therapy session. Now, for us here in this setting, I'm suggesting the non-directive, because with the directive, there's too many technical approaches that comes out of this that you have to be trained for. For instance, one of the first things with the directive could be CBT, and we are not trained for that. There are other kinds of very intricate, as they say, therapies. But for the non-directive, we can just be us in terms of listening, and I'll show some of that again. But I want you to remember, it is the client who is the important part here. You, as it says here, you involved in listening, supporting, and advising the client without directing the course of action. You are hearing from them. You're not taking control. You are using what they give you to bring that level of direction, allowing them to take the lead, reflecting on the information, bringing it back to them, working out what they are saying, and bringing clarification, letting them realize that they have the answers. We are here to help them with those answers that they have, and to put them in very strategic patterns or protocols that would help them to go forward. So like left foot in front of right foot rather than jump. How do I walk rather than jump? Or how do I walk rather than crawl? But you can walk. I'll help you to get up. So therefore, those important. In terms of non-directive approaches, we basically go to look at the client-centered therapy, which is the client, again, having the resources to improve. And that's what is called client-centered therapy, or person-centered therapy, which is best for us in this setting. I want to bring you to the more effective approach, where you are looking at the basics of the crisis. And looking at the whole issue of the intervention. So it's an acronym here, BSICS. Looking at the whole thing of behavior. What do people do? What are they doing? How are they behaving? And you're hearing their behavior. Now, their behavior is going to be presenting to you in words, not all action, but in terms of the words. You may see some behavior. They may be spinning, jittery, looking, but you're hearing what they are doing more from what they're saying. So you've got to listen to that. How do they feel? You want to get those feelings, those emotions. The somatic, how people respond physically. They might be having some pains, headaches. They may be feeling nauseous. There are lots of other things that may come up in terms of their body. And that is important for you to realize, that in terms of the somatic. Interpersonal, how people relate to others. We want to hear that too, because you must remember that these people that are speaking to you, they're going back home. Some of them alone, but even if they're alone, they're expecting some kind of company, an aunt or uncle, the neighbor. These clients are not isolated. in themselves. There's an auntie, there's a family member, there's a neighbor, there's a friend. So how are they relating to people? Because whatever suggestions we make for them, whatever the therapy is in terms of how we're going to fit them with exercises or homework, whatever, they are going back to a home base. And there are people in that home who were not in the session. So you have to hear how they're responding to those people so that when they go back, that the therapy you've given them or the therapy you've decided upon also going to involve those people, because you want to know how they, so therefore you want to know how people relate to others. And that's very, very important. Very important to me. And that's what I do a lot of that now, make sure that my clients are well related to the people that they're going back to, because what you could see a client doing well in your room, but when they go back home, it's a whole different kettle of fish. Or you know, how do people think? Cognitive. What kind of patterns of thinking? Are they rational? Are they rational? Are there's anxiety? Because the feelings create thought patterns. Are they thinking logically? Are they logical? So that you want to hear, so that when you give them something to do, it's going to impact that, so that you are listening, and all this is part of your listening. You have to be very, and that's what makes it effective, is that you are involved. And we're going to look at that again, but forget, we are going to be involved in that. And I want you to get really passionate about what you're doing. You cannot be sitting down there talking to the person removed from them. That's what we're going to look at just now, to the word empathy. And of course, the last S, spiritual, how people believe and value. Because your belief system is going to establish your values. So if I presented something to you, you're going to sift that through what you believe. I don't believe this. I don't believe that, because that's your belief system is affecting identity with people, maybe what you eat, places where you go, how you interpret certain concepts and principles, because I have these basic things. And how does that fit into the transformation that we're looking for in terms of the counseling? We have here, just a minute. I have to do some homework here. Hold a minute. I think this needs to go up a little more in some way, the other, so that we can see. Right, there we go. So the love triangle, the LUV, is something that we use in crisis. They understand, they listen, they validate. It's important for you to have an understanding of what you're hearing and who is before you, so that the person really is not just rambling their stories. It's important for you to listen. So to listen, yes, with an understanding, and to validate, so that while they're talking, there are going to be some little, yeah, very well. So you're not really interrupting, but you are giving these little sayings, not just to look at them blank and sitting down there, but we have to say something like, I will not say much, as I said, a little nod, a little, yes, I go ahead, I understand, you're doing very well, so that there's a validating. You want the person to begin to feel, yes, I matter. My story is being heard. I am very, very well understood. You're following me. And so therefore, when the person is finished, so by the time you start to paraphrase, after they've spoken, the person will really appreciate, yes, that you have listened and understood, and you've also encouraged that engaging by the validation. So these three will help the paraphrasing, help the even reframing, and also help the engaging, the listening, the understanding, and the validating. And that is important. So some more effective approaches. We looked at empathy already. Dr. Hinkson, and most people, of course, works the empathy, that identifying with the person's issue, but not carrying it. It's just not sympathy. You don't want to get sympathy unless you start to cry and say, oh, yes, I know how you feel. Hold on. They don't need to know how you feel. Hold on. It's what they say. Listening to their stories. And I was thinking of how to work that story, what we call narrative therapy. And this is basically what it is also. So that they're giving the narrative and you listening and you understanding and validating and giving them back the story in what we call reconstructing that story. Learn to manage emotions. It's important for us to manage emotions during the sessions. So you may have a little bag with your own little pack of tissue. You could pull out a tissue. You could have some water in terms of how to affect their breathing and the controlling, but you also go to manage emotions in terms of how you speak and relate to them and encourage them to be free and encourage them to be open, encourage them. And those you will get that information from, you would have gotten that information, sorry, from Dr. Cummins and Dr. Hinkson, the whole issue of working through that context of helping the person to be very relaxed and very warm in your presence, developing possibilities. And that's where Dr. Huggins talked about that developing of the coping mechanisms. Yes, so coping is actually developing possibilities. And you have to learn how to work those possibilities. It's not about what you can do as what you cannot do. It's about what they can do and what they would do and they should do. So you're taking those possibilities from what you are hearing them say and working that forward. So these are basic approaches to counseling, general counseling. And I dare say, I will say, we are looking very much here at client-centered and of course narrative therapy as we listen and we work through the sessions. Thank you.
Thank you very much, Dr. Niles. Very well presented again, giving us a very integral approach to counseling. And some of these are so basic that sometimes we just take it for granted, but very, very critical and, crucial to have this relationship between the client and the therapist. All four of our presenters did mention that special relationship. It is so important, and building that relationship moving forward is what is important, and you all address to different sides of it. So thank you very much. So at this time, the floor is open for questions. So we invite you all to ask questions. If you wanted to type, you can type, or you can unmute your mic and ask questions. Okay, while you all are thinking about a question, I have one question for Dr. Clarke. You talked about the importance of guidance and advice. Now, most of the time, if you're not trained well, we are so anxious to give advice. And so we always think that the role of the counselor is to advise. So Dr. Clarke, tell us how we can prevent or stop that from taking precedent, while we are in counseling session, how will we know that we have deviated from guidance and entered into advising? What will be the warning signs to tell us?
Okay, well, let's start with the most fundamental. The most fundamental is that here is an individual who is experiencing some difficulty, emotional or otherwise. They experiencing some difficulty. So you come to that person or that situation or that environment, okay, and you come to it with your own biases. Number one, don't say you don't have biases, because I will tell you that's not true. So you come with your own biases your own previous experiences, your core beliefs, your religious beliefs, all of those things you have in your mind. So you come to the client with that mindset. Okay. So when you look at this situation, what do you think comes to your mind? The first thing that comes to your mind is how you coped, how you thought about this, that all of those biases just layer up in your head about how you think that person should go about resolving their problem. But, and this is fundamental, but they are not you. They have a whole different cultural, emotional, domestic, they have a whole lot of things happening to them. You don't even know if they might have physical disabilities, emotional disabilities, educational disabilities. So you come to them not knowing an awful lot about them. And in the absence of that information, you're telling them, you know what I think you should do? I think you should not just, a good example is domestic violence. I think you should leave your husband because, no person should treat another person like that. Okay, that's a valid point. But have you taken into the consideration that when that person walks out of his house, what the implications are? No. Let's say you had that situation and you were able to draw on family support, or you had some account in the bank, or you had a different experience. So if you advise someone that this is what they should do without knowing all the background information, you're likely to cause them harm. And the critical element of counseling is that you should not cause harm or additional suffering or hardship to the person. So it's always best to understand whether, as I think Dr. Huggins talked about that in her first slide presentation. Can this person do what you want them to do? Are they capable? So that is just as basic as it comes. I don't want to give any technical jargon. Can they do it? Are they able? You don't know what the emotional state is. So how could you ask them to do that? And because individuals don't take on board those fundamental elements in their counseling, they act out of their own emotional bias and their own religious perceptions. And this is one of the things that I am always very careful about, especially to our people of our religious persuasion, that we tell people, you should do this, and you should do that, you should do that. But can they do it? Is it possible? So we need to step back, do some critical examination. So, and they might take your decision and it might end up in worse situation for them. And then they say, but you lose credibility because they say, but you told me to do that and I did that. Look what happened. What are you going to say to them now? So you're sticking your neck out and you're putting the possibility you might get it locked off. So, and your own credibility becomes questionable afterwards. That's the most fundamental before going on to all the other points. So it's not advisable to give advice.
I think we need to stop being pastoral or stop being a Christian for a while, because as you rightly say, you tend to want to be religious and give it. That's why I suggested the client-centered therapy, where the person, you have to listen to them and not listen to yourself.
Thank you so much. And adding to that is we need to have a lot of prayers, okay? Approach everything prayerfully. And I would again emphasize and reinforce that prayer works wonders, and you commit the whole situation to the Lord. He gives you the wisdom, the words to speak. Yes, the knowledge, the training is so important, but at that point of time, sometimes we forget that this is what we were supposed to do. So it's so important to calm yourself, commit to the Lord, hear his words and then proceed. So that's what Christian counseling
Uh,
is all about. Yes.
Dr. Chan, I just want to say this. I am careful with the prayer part. No, prayer is good, but sometimes when we are praying, the things we say is also like if we're advising the person through our prayer. And
We have to
sometimes
tell
that
them
is
how
so
to pray.
rude.
There will be
That is so
another
rude.
session on that.
Yes, we have to be
Dr.
careful
Niles,
of
don't
that.
worry. There's another session on teaching people how to pray. Okay. All right. So that leads me to the next question. Dr. Hinkson or Dr. Huggins can answer that. You all said about the probing. Both of you mentioned about the probing questions to be able to probe. There should be questions when we are in the session. One of the questions that we are also engaging in is to probe. So how far should you go to probe? How far should probing take place? To what extent? How far into the person's private life or whatever the case might be, should you go with the probing question? Is there a
Um,
limit for that? How far you should go?
yeah, I always think you should go, I'm old school. I believe you should go back to childhood, because childhood, forms your personality. You have identity formation at that point in time, and sometimes that's where the trauma happened. That's where the issue began. That's where, issues that how you coped and how you dealt with something occurred. So if you want to find out what's going on, look into their relationship with their parents, look into their relationships with their siblings, and it can give you an indication as to what happened with that person and how they dealt with these things all along. There's a lot of people people walk around with trauma all the time, and they don't know it's trauma, and they don't know that that's how they've been coping with it, and where it began. So I think you should probe and from the beginning.
Thank you. And there
Can I
might
just
be,
add something,
yeah,
Dr.
sure.
Chen?
Yeah, yeah.
Okay, so thanks. I was going to agree with Dr. Huggins in terms of as you build a relationship with the client and you are probing or asking more in-depth questions, that relationship with them that you have built will allow you to ask those questions. And the client will let you know when you may have gone too far or because of their reaction, but it is necessary sometimes to probe as far as you can in order to understand why they are doing the things they do. So it's just like your attachment to your best friend or your partner, because of the trust and the caring and the respect that you have for each other, can allow you to ask very vulnerable questions.
Yeah, thank you.
Also, Dr. Chan, it's important for me that probing is coming out of their statements. So I am not going to just come out of the blue and ask, hey, how did mommy treat you? If you mention anything about parenting or something your child, or I ask the question, is there any negative things that you want to share with me from your past? And you might mention one, that's okay. So I take your questions, I build on the questions from your own story. And that's how I will suggest it's done.
I totally agree, Dr. Niles. I remember one time I was at a family reunion, and my aunt, who is about 65 years old, would talk about how she got licks when she was a child. And I would sit there and say, if you still remember you getting licks at 65, then something formidable, something significant happened. And, that's something you should absolutely probe about. So people always, they basically recite things that was very significant in their lives in a matter of fact way, and in a very, by the way kind of conversations. And if you pick up on that, you'll be surprised what you can find out from the information.
Yes, absolutely. So thank you for that. And so probing can go as far as childhood. Probing is based on the relationship you would have developed with your client. And Dr. Niles very well pointed out it should hinge on, or it should be a launching pad from what they would have said previously. And then probing is usually we do probing based on what they would have said previously. So thank you for pointing that out. I think we are running, we just have 1 minute more. So Dr. Niles, a question to you in 1 minute, if you can answer. You very interestingly, you talked about sympathy and empathy. How would a counselor or the person who are engaging in counseling be able to distinguish whether they are moving from sympathy to empathy, or they had started empathizing and they moved into sympathizing? So there can be dangers of engaging, if they started with empathy, they moved into sympathy. How they can, avoid those kind of, situations? It's very easy to move
Um,
from one to another. Yeah.
oh yes, yes. The question Dr. Cummins had, Dr. Huggins had asked about, is the client ready to hear?
Yes.
Sometimes you have to ask,
Very
is the
important
counselor
question.
is the counselor ready to hear? And that's why it's important for the counselor to have some kind of debriefing for their own self, identifying their own strengths and weaknesses, coming into the program, understanding that I may hear, and I think Dr. Clarke had mentioned last week, was it last week? We talked about transference, Dr. Clarke, and counter transference. There's some questions about that. And that is where the issue is about sympathy and empathy. Because where you start to feel that effect from the stories, you make it your own, and then you want to identify with that person, and you want to say things like, I know how you feel, I've been there. So those statements are not valid at that point. You are to be as neutral as, but yet engaging as. So when you start feeling those emotions coming from your own backgrounds, your own weaknesses, two things: make sure you redirect all the questions to the client for the client's sake, not about you. If that doesn't work, you can either stop the session and refer the person to somebody else and let them know, look, this is very overwhelming for me. I think the honesty there is important. I am really feeling for you, and I'm getting so emotional about this myself. It reminds me of, and I need to put you onto somebody who can guide you. And that is important when you can be honest about how you feel, because that issue of countertransference is real, and how we work between the empathy and the sympathy. Uh, you have to not want to carry the burdens personally. You are working with them from where they're at and understanding their pain, working with their pain and encouraging them. And we heard about that from Dr. Huggins. Let me say Camille. That's the name I know, Camille. Camille was talking about encouraging. It's important for you to keep encouraging them less, so that the more you encourage them, the less you see about yourself.
Yeah.
And I think that's where the balance is, where you focus a lot on them and the listening and the understanding of their plight and the validating them. So you lose that identity of yourself and you really work with the client successfully.
Thank you so much, Dr. Niles. I think you gave your closing statements there. So let me ask you this. Just before we close, any closing thoughts that you want to leave with our, our folks who attended today's session? Starting with maybe Dr. Clarke, Dr. Huggins, and Dr. Hinkson. Dr. Clarke?
He's gone.
Okay, go ahead, Dr. Huggins. You can go ahead.
I think it's, I think we are now in a realm where we need to talk. We're not used to it. So please have patience for people who, think they want to talk, but they don't know how. We are not used to talking about ourselves. We're always just used to doing and not talking. So it's just a new concept around the world. Just be respectful of that current, of that, and have patience.
Thank you so much. Very, very important point. Okay, Dr. Hinkson.
My closing thoughts would be for the counselors who are taking on clients, to not ignore how they feel in this time to not become overwhelmed and to ensure that they are also talking through any lingering sympathy that they have to also manage themselves as they're attempting to manage and assist others. Grief is overwhelming, and the amount of challenges that one person may have may be too much sometimes. So also seek help for yourselves sometimes.
Thank you. Very important point again. As
I,
counselors, we
I,
can be overwhelmed. Yes, Dr.
yeah.
Niles.
I just want to reiterate Dr. Clarke's voice, what I said. The culture and the religious part, please remember, don't approach your client from your perspective of your culture or for your religion. Let's hear them and let's work with them on a very neutral platform.
Sure. Thanks for making that point. So let's see, Dr.
Amen.
Clarke, are you there?
Yes,
You
ma'am.
know, oh
Yeah,
yeah.
your closing thoughts as we wrap up
Oh,
today's session. Mhm.
well, I want to say that for those individuals, those first responders that are going in, I want you to, first of all, feel confident in that you do have the ability to render help, support, and assistance to those individuals who are experiencing emotional discomfort. And I think if you go there with resolve, but yet humility, and you can recount some of the, not all, but at least the important guidelines that we have given you, you will manage. And so you go with a prayer in your heart that you're there because you want to make a difference to this person, you want to create some healing, and you go there with that very basic commitment to make a difference. Don't go there with attitude and I know it all, and I am more knowledgeable than you, and your religious belief system is not as strong as mine, and quote Bible texts and also I think you'll make a difference. But as soon as you let your biases protrude, there's going to be a problem. There's going to be a problem, and you're likely to cause more harm. And that is not what we are trying to do. Thank you.
Thank you so much, Dr. Clarke. And I didn't see any questions from our audience today. They were very quiet. Of course, Dawn is saying thanks to all the panelists. And thank you, Dawn, for your comment and interesting and informative session. So this brings us to the close of the session in emotional and psychological support. There's one session that is remaining is on spiritual and social support that will be held next week. But this brings us close to this segment of our presentation. But we will have a part 2 where all those who have attended, we had the attendances of those who attended the 4 sessions. We will be engaging you into mentorship. So that will be the second part of it. The first part was presentations. Second part is mentorship. So we are going to work with you, those who have shown interest and those who have attended all of 4 sessions. We will form a partnership with you, and we will do a part 2 where we have the practical implications. The practical sessions will be held in group basis. So we will have different groups set up, and mentoring will take place, and then we will regulate and monitor as you go into the field and engage in counseling with the person who have requested for emotional and social support. So that will be part 2. So we are finishing our formal session here, but we will send out information as how we are going to organize the part 2 of this segment. So God bless you and thank you for attending. And as we close, we are happy to have Dr. Amitsas, Dr. Oh, I think they just exited. Okay, Dr. Fern Samuel, I would invite you to offer prayer for us as we close. Dr. Fern? Dr. Samuel?
Yes, hello, can you hear me?
Yes, we can hear you.
Okay,
So we
let's
want
have
to,
a prayer. Thank you. Yeah. Our kind and gracious Heavenly Father, it is with hearts full of wanting to serve you that we have come together for these training sessions. And we cannot thank you enough, dear Lord, for each presenter who has given us invaluable knowledge and points to take away that so that when we reach out to people, when we try to be there for them in their grief or in their loneliness or in the emotional support that they need, that we will not put or project ourselves, our religion, or our own thoughts upon them, but that we will be listeners, Lord. And we can accomplish this only as we depend on you. I thank you for Dr. Susan and the university at Trinidad and Tobago that has arranged all of this for us. And I pray for each volunteer, Lord, in ACC, as we go forward to reach out to so many people in our communities, that the light of Jesus will shine through us. And we will be effective witnesses for you, Lord, even if we do not at first speak to them of Jesus' love. The few remaining sessions that are there, dear Lord, I pray that many will join and come and get the knowledge and be trained. And the rest of the day and the night that remains for us, I pray that you'll bless each one here. These few mercies I ask in your holy name. Amen.
Amen. Amen, Dr. Samuel, for she's one of our team members in ACC. So thank you for joining, and she has been joining every session faithfully. So thank you, Dr. Fern, for joining. So that's it for today. And thanks the presenters. They did a wonderful job. I'm so proud of them. And you have really touched us with your presentation, motivated us to, take note of some very important point that is important for us to move on with the counseling. Okay. All right. So I'll just stop.